So this is the first level isometric technique to help proximal hamstring tendinopathies. So that's pain right at the bottom of your butt cheek on your hamstring, right where the hamstring attaches onto the ischial tuberosity. Usually nearly every time when there's a tendinopathy, there's also a bursa or bursitis issue too. So the bursa is between the bone and the tendon, and it's designed to make a frictionless surface. When there's issues with the tendon, a tendinopathy, it's always an overload issue. So the tendon's doing too much load too, so it gets a little bit swollen and becomes a pain generator too. So the pain people feel, it's coming from the tendon itself and also the bursa. Can be some nerve involvement there sometimes, and often there's some funky things going on with the hips too. So just different muscle activations and control and things is different because of the pain inhibiting what's happening with the pelvis. So this exercise is isometric. So you do 4 sets of 45 seconds to a minute. If it's really painful, you might even be starting off at 20 seconds. So you're doing four sets of 20 seconds. You're doing this 2 to 3 times a day. It has an analgesic effect on the tendon, and you'll feel it within a couple of sets. It'll feel a lot easier. It's like, oh, that's just what the tendon wants. So there's something called tendinitis. So people say, I've got a tendinitis. There is that element that pathology does exist, but it's usually something that might last a week, maybe 2. But if you've got a tendinopathy or pain that's here and it's been there for months, you're looking at a tendinopathy. They're better with movement, so it feels better when you move. If you do too much, it can ache and might take half a day to a day, even a couple of days to settle down. Tendons are very sensitive to load, so sometimes you did something too much 3 days ago, and on that 3rd day it's just arcing up for no apparent reason. It's because of that. It also hates long time sitting too. It hates pressure. So the tendon and the bursa hates pressure or compression, so it doesn't like that. So this is the first thing to do, and you'll find it'll help big time. Then we progress further with that too. So the way we do this, we use a chair. The feet point straight up. You'll probably find one foot wants to turn out a little bit or turn in. Usually it turns out. Keep the feet straight, so both the attachments of the hamstrings are doing their job. And we want to be about 100 degrees. So that there is 90 degrees. About 100 will open here. It'll really stress the hamstring more. So to do this, neck is relaxed. You may need to have a pillow under your head. That's fine. Main thing is your neck is relaxed. The pelvis tucks under, so it goes under a little bit this way. Then I push my heels down into the chair. So it lifts my pelvis up about halfway. So if that's full all the way where this is flat, I come down about halfway. And I'm just holding that as a contraction. So I'm not going any lower, digging the heels into the chair, noticing keeping the feet straight, vertical. And you'll find that it feels really good usually. You may feel that actual pain in the hamstring. You might feel that, that's fine. You may find that hamstring feels a lot weaker. So if you had a problem on the right side, you'll find the left is probably doing a lot more work. That's all normal. And this exercise will help balance that out over time as the hamstring tendinopathy is healing. So we do 45 seconds to a minute. You may shake, this is fine too. And we don't do any more than a 2 out of 10. So if you do this and it's getting up around a 3 or 4 out of 10 in pain or tenderness, come down, make less time, don't come up quite so far. And the main thing is just reduce the time that you're doing this for. And then we'd come back down. Give it a rest. You can let it rest here. You can get up, have a little walk, maybe for 20, 30 seconds, a minute if you need to. And then we do it again. So the main thing is that before you do this, your pelvis tucks under this way. So you don't want your back to arch. So people can lift up and the back actually arches to lift up. You'll get a really sore back, lower back. So pelvis tucks under, drive the heels down, and gradually you're taking your elbows away. It's easier to push in with your elbows. Elbows go away too, so it's all just hamstring. So we do that 4 sets, building up to a minute each side. You'll feel it feels pretty good. Over time, so we're talking weeks, you find that you're about so if my right leg is the one with the problem, I'm starting to put more weight and pressure into this side. So right now I just changed it. It doesn't look like much, but I've got about 60% of the drive coming from this leg now. So I've got less pressure going through this one. Then over time, I'll gradually make that 70, 80, to 90% to a point where you feel you can lift that up and it's all just hinging off that one leg. So you're stressing the tendon, giving the right amount of load, which is exactly what the tendon wants. Tendons love load. The tenocytes within the tendon, they love the load. Give it enough, it'll heal. Give it too much, it'll really play up. And don't give it enough, it won't get the stimulus to heal properly. So what's okay with loading with this, especially as you gradually increase the loading, so more weight going into one side, it can be, you're allowed to have this sore and tender in the morning, the next day, and then by afternoon, by midday afternoon, it's back to being its usual self or less pain. But if it's arced up and it's staying sore all day and into the next day, you did too much on that day before. So you either held it too long, put too much weight and pressure into that one side, so you just back it off. So you want to find the optimal amount of loading. So this is best done 2 to 3 times a day. It'll knock out pain. So if you start off with maybe a 4 out of 10, just walking around, you do this exercise, it drops down to a 2 out of 10 really quick. Maybe by the time you've done the 4th set, it might be a 1 or a 0. So that's the tendons loving the load. This is good. What's really, really beneficial that I've found, especially for proximal hamstring tendinopathies, is Gelatin and vitamin C protocol. This is from a nutrition journal in 2017. You can look up the article. If you type those things into Google Scholar, it'll come up. So 1 tablespoon of gelatin in boiling water with Ribena or orange juice. It needs 50 milligrams of vitamin C to be sucked into the cell. And then the way you do that, you take that solution 3 times a day. You take that, you wait an hour, becomes bioavailable, so it's in the digestive tract ready to go into the cells after 1 hour. Then we do this loading. So there's a 10-minute window where the loading will, the collagen from the gelatin, the collagen gets sucked into the tendon. And I've seen people have massive results within a week, and then within 3 weeks the problem's gone, and a problem that's been there for months or even years is gone. So the isometric loading is a key, but the gelatin and vitamin C is hugely helpful, I've found, for this particular tendinopathy. But of course, check with your doctor as well, depending if you're a diabetic and that kind of thing too. So check those things out. And where you go from this will be eccentric work and then isotonic work. So to do eccentric work means that the muscle's contracting while it's lengthening. So I use both feet to push up, and I go all the way up this time. So I'm flat here. And again, I've still tucked the pelvis to start with. There, so I'm not arching the back at all. There. Then I come down on one leg. So the side that has given me some grief. So come down slowly in control. 2 legs back up. Come down slowly. Okay, so we want to be able to hold a isometric contraction here first before we start that, of course. Then we'll be working on 3 sets of 10 reps. And then where we go from there is isotonic. So there's other exercises we can do. Isotonic though means that we're working on both the shortening and the lengthening phase of the contraction. So we're make sure the pelvis tucks under, pushing through both heels, not using the elbows at all the way up. So it's flat here. Then 1 vertebra at a time coming back down. Push through again. Spine curling up. 1 vertebra at a time back down. So as you come up, it's like, so you're pushing into the chair, it's like I'm unvelcroing my back. And then I'm really carefully velcroing the back down. So each segment's getting control. And it's useful to pop a ball between your knees when you do this too, so it gives the adductors a bit more work to help with the hamstring to heal. And we're looking at 4 to 5 sets of 10 to 20 reps with this, and it can be weighted. You can put a dumbbell or a kettlebell on here, so you're weighting the exercise.